Mammograms are a very low-cost but effective way of being able to detect cancer in its earliest forms. It's often recommended that people start getting their mammograms at age 40, and you get them annually until you decide you don't want to get them anymore, which is usually in your 80s or so. It should be noted that all of the cancer organizations and the breast surgery organizations are recommending that women continue to get them for the most part every year or so. There are some people who may qualify for getting them every 2 years, where you won't worry quite as much, but the general recommendation is that you continue to get them once a year. The mammograms can also be obtained at an earlier age for those who are at high risk. For instance, if a person has a mother or sister who developed breast cancer at age 40, we tend to recommend that people begin their mammograms 5 to 10 years earlier than that youngest person in their family diagnosed with breast cancer. So in this case, we would recommend that people start their screening starting at age 30 or 35 at the latest. If you would like to get a mammogram done here at Sinai-Grace Hospital, it's available on the second floor of our professional building in the mammography center. Oftentimes you need to call to make the appointment, and it can be obtained within a few days. However, if you have a pressing complaint, they oftentimes are able to accommodate you on a same-day service basis. Oftentimes, when people go for their first mammogram, they will oftentimes be called back for additional films. This is because this is the first time that your breasts are being examined by mammography, and a lot of times you have calcifications and things of that nature that are benign, but it's just an indication of breasts just doing the normal things that breasts do. If you're called back for your first time or even subsequent times, the majority of times it's just to get additional films, and there's nothing to be alarmed about. Even if they say that you need a biopsy, the majority of biopsies, less than 90% or so, end up resulting in anything that's of any significant concern. So therefore you shouldn't be concerned if they have to call you back for additional films.